We are live now, sir.
Good evening to all. This is Chandra Mohan, ortho physiotherapist from Sri Samraj Physiotherapy Center, Dindivanam, Tamil Nadu. A warm welcome to all for the EXRX India's and Sri Samraj Health Services Private Limited's presenting Webathon, a web series enthusing for the world record, not just counting only on the topics, but also providing the knowledge for the physiotherapists in India and 23 countries, and also providing online OG consultation for the women's health related issues in association with Peak Health Studio, Chennai, Dusar Creations, West Bengal, and powered by Fitness and Rehab India YouTube channel. EXRX India's 196th topic is Airway clearance devices used in cardiorespiratory physiotherapy. Will be presented by Dr. Vishnuvardhan, Associate Professor and HOD, Cardiorespiratory Physiotherapy Department, Dr. APJ Abdul Kalam, College of Physiotherapy, Loni, Maharashtra. I welcome EXRX India team members, Dr. Rupesh and Professor Duna, and now I welcome our resource person, Dr. Vishnuvardhan, and request him to commence the session. Dr. Vishnuvardhan, please.
Yes, sir. Thank you, Dr. Chandra Mohan, for the introduction, and thank you, team EXRX India.
Please do screen sharing now.
Yeah. I think you're able to see the screen. I will start.
Yes, sir. Yes, sir.
So good evening, everybody. So the topic given to me is airway clearance devices in cardiorespiratory physiotherapy. So first one, we'll see about the vicious cycle of the poor airway clearance. There's an inflammatory response in the lung that leads to pulmonary defense mechanism ineffective. And there is increased mucus production followed by mucus plugging in the airways. That leads to lung damage. So in simple terms, this amount of secretions retained in the lung, like conditions like chronic bronchitis, bronchiectasis, and cystic fibrosis. Now today we'll be seeing the devices which can be used in the following lung conditions. So today we'll be seeing about 6 devices, airway clearance devices. First one is Aerobica, second MetaNeb, lung flute, fourth is Quake, fifth one is RC-Cornet Plus, and sixth is Simeox. So first we will go with the first device called Aerobica. So this is a device Aerobica. Aerobica is an oscillating positive expiratory pressure device. This Aerobica positive EP device can also be used simultaneously with nebulized aerosol drug delivery. Now these are the parts of Aerobica. This is the mouthpiece which you see over here. The other end is connected to a nebulizer. And right below down, there are 5 resistance settings that is adjusted as per the patient's capacity. So over here, which I had already mentioned, there are 5 resistance settings. One going to the right is minimal resistance, and one going to the left is going for a maximal resistance. And this Aerobica device has an added advantages of a nebulizer. The nebulizers also can be attached with this airway clearance device. What are the indications of Aerobica? Chronic bronchitis, cystic fibrosis. Contraindications, intracranial pressure which is having more than 20 mmHg, hemodynamic unstable patient, epistaxis, hemoptysis, and untreated pneumothorax. So in this Aerobica device will not be used in the following contraindications. Coming to the procedure, the patient has to place the mouthpiece in mouth and he has to close the lips around it. The patient has to inhale for 2 to 3 seconds before exhaling. And after this, the patient has to perform 2 to 3 huffs to clear the airway. And this procedure can be repeated 10 to 20 times. So first, the patient is instructed to inspire for 2 to 3 seconds, hold, and then go for an exhalation. So these are the steps to use Aerobica. At the end, I'll be showing the videos of all the devices. So initially will be the PPT slides. Now the procedure. The resistance indicator is set at the lowest setting. The patient should be seated in a comfortable position. Patient is instructed to inhale through the device, taking a deeper breath than normal, but not to total lung capacity. Resistance should be set so that exhalation lasts for 3 to 4 times longer than inhalation. So exhalation should be lasting longer than inhalation. So resistance can be increased, as I have already mentioned. Towards left, resistance can be increased by moving the indicator to the left and to the reduced resistance towards the right. Patient is instructed to put the mouthpiece in mouth and close the lips around it to ensure an effective seal. And after the patient goes for inspiration, the patient, ideally, the exhalation should last 3 to 4 times longer than inhalation, and the patient has to exhale actively but not forcefully through the device. At least 10 breaths can be done, and after this, the patient can go for 2 to 3 huffs. That is, huffing is opening the glottis to clear the airways. So this is the procedure of the Aerobica device, and we'll go for the recent advances. One of the recent advances is done in the year 2019 in Canada. It is the cost effectiveness of the Aerobica oscillating positive expiratory pressure device in the management of COPD exacerbation in Canada. So this device was used in COPD patients. So there were 2 groups. One group with the Aerobica device, and the other group there was no Aerobica device. So what the outcome measures used in this study was the healthcare cost and the quality of life. So it was found that Aerobica oscillating positive expiratory pressure device is one of the potential component of a treatment strategy to improve symptom control. It helps in reducing the symptoms in COPD patients, and it helps in reducing the healthcare cost of the patient. At the same time, it helps in improving the quality of life of COPD patients. So this comes end of Aerobica device. So now coming to the next device, it is called as MetaNeb system. So over here, you can see this system is on a stand. At the same time, what you see over here, there's an oxygen port connected, and this is the handset. The MetaNeb system is a therapeutic device that uses a systematic approach to enhance. It helps in mucus clearance, lung expansion therapy, and helps in resolving atelectasis. Parts of MetaNeb. This is called as continuous high frequency oscillation, CPEP, continuous positive expiratory pressure, and this is used only for aerosol delivery. This shows high frequency oscillation and down low frequency oscillation. So there are 3 more: CHF4, continuous high frequency oscillation, CPEP, continuous positive expiratory pressure, and aerosol mode. This is a handset which is connected to the patient, and there are 3 dots over here. That is, 3 dots is maximal resistance, and there is high resistance, medium resistance, and low resistance. This resistance is fixed as per the patient condition, and you see the tubings over here which is connected to the patient. So this, you see here, this device, it should be used in hospitals preferably, and it is connected to an oxygen port. And see the tube over here, just directly connected to the patient. At the same time, the nebulizer is also attached. So it also has an advantage of a nebulizer which can be attached directly to the mouthpiece of a patient who's well conscious and he's able to do the procedure. What are the modes of MetaNeb? CPEP, continuous positive expiratory pressure, continuous high frequency oscillation, and third one is aerosol. Indications: it can be used in cystic fibrosis, asthma, chronic bronchitis, bronchiectasis, neuromuscular disorders like Guillain-Barré syndrome, GBS. It can also be used in mechanically ventilated patient, that is intubated patient in the form of endotracheal tube. MetaNeb, so this is as I told you, as this device can be used on ventilated patient. You can see this MetaNeb device is directly connected to the T adapter of the inspiratory circuit of the ventilator. So that is the advantage of this device. The mechanism of MetaNeb. So first one, it's the total time duration of MetaNeb is 10 minutes. Initially starting with 2.5 minutes of continuous positive expiratory pressure with aerosol that is used for lung expansion, followed by 2.5 minutes of continuous high frequency oscillation with aerosol that is for secretion clearance, followed by 2.5 minutes of continuous positive expiratory pressure with aerosol for lung expansion, and again same 2.5 minutes of continuous high frequency oscillation with aerosol for secretion clearance. This CPEP is actually providing a positive pressure which helps in opening the airways, followed by CHFO, continuous high frequency oscillation, which helps in producing oscillation and pushing the secretions from the peripheral to the central airways. So the total duration is of 10 minutes. This device can also be used in pediatric patients. So CPEP mode. It is combined with continuous positive pressure. It's also a combination of aerosol delivery, CPEP with aerosol delivery, increased flow beyond secretions, reduces the incidence of air trapping. As I mentioned, it provides a positive pressure which pushes the secretions and reduces the incidence of air trapping. Medicated aerosol combined with continuous pulses of positive pressures delivered to the airways to loosen the secretion. And CHFO, that is continuous high frequency oscillation, is used during both inspiration and expiration to form a pressure gradient to the smaller airways where the secretions are trapped. So this CHFO mode, it produces high frequency oscillation and mobilizes the secretion from periphery to central airway. That is, it reduces the viscosity of the mucus. Now, the recent advance of this device, MetaNeb. So this study was performed in Australia. It's an innovative chest physiotherapy technique which was performed in Australia. An 8-year-old boy suffered this is a case study. The 8-year-old boy had a burns of around 61%. So on day 6, this patient had a respiratory complication, and the patient had multifocal regions of on the X-ray. That is, the patient had gone for a lung collapse. So you see the X-ray over here. Before using the MetaNeb, you see the bilateral mid-zone opacification of right upper lobe and left lower lobe. But after post 4 days of MetaNeb intervention, their lungs were clear. So you can see over here the difference between pre as well as post. So it was used on an intubated patient. So this MetaNeb system was highly successful in the treatment of this critically unwell child and helps this case study suggest that device may be beneficial in atelectasis secondary to poor secretion clearance in ventilated pediatric patients. So this is evidence suggesting that the device can be used in pediatric patients as well as can be used in mechanically ventilated patients. Now this comes end of the second device called as MetaNeb. Now we are going to the third device, lung flute. So lung flute, it is also a positive expiratory pressure device. It's a plastic. It consists of a plastic mouthpiece and is attached to a mylar reed that flutters during use. So if you see here, this is a lung flute. It has a plastic mouthpiece, and this is called as a reed. And this mylar reed oscillates when the patient goes for an expiration. The mylar reed increases the air mass within the device. This provides acoustic impedance. When the device is being used, the mylar reed will oscillate at a frequency that matches the resonance frequency of pulmonary secretions. So it produces a frequency around 16 to 25 Hertz. The viscosity of the secretions is reduced by mechanical vibration resulting from sound waves. So this reed oscillates and produces a frequency around 16 to 25 Hertz, it creates a back pressure inside the airway and helps in pushing the secretions. Indications, which we are already discussed, is same as well as the contraindications. The procedure, this is a procedure. The patient has to place the mouthpiece, maintaining a tight seal on the mouthpiece during inspiration. The patient is instructed slowly to inhale to 3/4 of the maximum breathing capacity and then exhale to FRC, that is functional residual capacity. When the patient blows into the device, the reed which you are seeing here, this is the reed which oscillates and produces a low frequency sound waves. The sound wave produced travels down the tracheobronchial tree. Once it vibrates and it goes down the tracheobronchial tree, it vibrates the tracheobronchial secretion. This vibrations helps in clearing of the mucus and the patient can expectorate. So this is the procedure of lung flute device. So video, as I told you, it will be seen at the end. Recent advances. It was done in Egypt in the year 2020. They want to see the efficacy and safety of a new acoustic device, the lung flute, for sputum induction and lung physiotherapy. So this study was done to assess the efficacy and safety of lung flute compared with the standard methods. So the outcome measure used were the first one, the forced expiratory volume in first second with the help of a PFT, and then sputum volumes. That is, they collected sputum volumes on a sputum container. That was one of the outcome measure. And the second one was forced expiratory volume by the help of PFT. So this study was done it's pre as well as post the time interval of 1 week. After 1 week of time, the post study results show that the weight of the sputum was significantly higher in all the studied patients induced sputum by lung flute, and there were, as the secretions are clear, there was a significant improvement in forced expiratory volume in 1 second after usage of lung flute, and there was also a greater improvement in exercise performance. So this study showed that this study is effective. This lung flute device is effective and a safe device and can be used for airway clearance techniques. Now this comes end of the, I think I'm right, the third device called as lung flute. Now we are entering to the fourth device. It is called as Quake. You can see here, this is a Quake. Quake is a positive expiratory pressure device. It is used during both inspiration as expiration. It's a portable handheld device. The parts of Quake, the mouthpiece, 22mm mouthpiece. It has an internal vein and the outer barrel with opposing veins. When the internal and the opposing veins counteract with each other, it produces a resistance. At the same time, there's a soft touch rotating handle. So when you rotate, you can see over here, the patient rotates the handle while inhaling and exhaling. So the more he rotates faster, the higher the frequency, and less he rotates, the lower the frequency. That is the mechanism in this device called as Quake. So it's a soft touch handle, as we have discussed. It is all dependent on the handle, how you rotate, and it produces the frequency vary during both inhalation and exhalation. The faster the patient rotates the handle, the higher the frequency. The lower the rotate, lower the frequency. So this is all about the Quake, the procedure of Quake. Coming to the recent advances, effect of Quake device, training on enhancement of drainage in patients with chronic bronchitis. So this study was done on patients of chronic bronchitis in the year 2019. The study was conducted to determine the effect of Quake device on enhancement of drainage in patients with chronic bronchitis. So there are two groups in the study. One group, Quake device with the conventional breathing exercises. The other group was partial drainage with the breathing exercises. The study concluded that the Quake device was more effective than the group B, that is
the group B, which had partial drainage and breathing exercise in draining the secretions. And second one, there were two outcome measures. One was draining the secretion, and third one, there was an improvement in ABG values. That is, once the secretions are cleared, obviously the lungs, there is an improvement in ABG values in the form of increase in PaO2 and decrease in PaCO2. So this device is also effective in clearing the secretions in the lung, and it was done in Egypt in the year 2019. Now coming to this comes end of Quake. We go to the fifth device called as RC-Cornet Plus. Initially it was RC-Cornet. The upgraded version is RC-Cornet Plus. This device has four functions. It widens airway, relieves respiratory distress, mobilizes the obstructing and thick mucus, reduces coughing, makes it easier to cough up phlegm. What are the parts of RC-Cornet Plus? So over here, it's a mouthpiece. This is the mouthpiece which you see over here. And this is the adapter where you can attach the nebulizer. And this is a valve tube. Again, I repeat, this is the mouthpiece which you see here. And this end, and it has an added advantage where a nebulizer can be attached. It has two different forms of treatment. It has two settings, that is setting 1 and setting 2 on the mouthpiece. The settings can be changed by turning the mouthpiece. This will be well explained in the video. Setting 1, it helps in stabilizing the positive expiratory pressure, that is, it enlarges the airway and promotes collateral ventilation. And setting 2, it mobilizes the positive expiratory pressure, PEP, that is, it helps in mobilizing the secretion. Setting 1, it helps in opening the airways and promoting collateral ventilation. And setting 2 helps in, it has fold resistance setting, which helps in mobilizing secretions. RC-Cornet Plus Trachea, it is the same device, but it has a different mouthpiece which can be directly attached to a patient who is on tracheostomy. Okay, this is the mouthpiece, which is slightly different from what you see over here. This is the RC-Cornet Plus mouthpiece. This is different. RC-Cornet Plus Trachea. This is different because it is specifically used for connecting to the tracheostomy. Those patients who have a permanent tracheostomy, this can be connected. And the patient must be very much conscious and oriented. So you can see over here, this device can be attached directly to the tracheostomy tube. So we are done with RC-Cornet Plus. Now coming to the last device called as Simeox device. So this device is having 3 programs. You can see over here, it has 3 programs. Maybe next slide you can see. Yeah. It's an on and off button. It has 3 programs. Program 1, which is having 6 exhalations per cycle. Program 2, 8 exhalations per cycle. Program 3, almost 10 exhalations per cycle. And this is the power. It again depending on the patient, 25%, 25, it's like 25, 50, 75 and 100%, and this shows the performance. So coming here, it's a control panel which has 3 programs. This is a remote control button. So when the patient presses this remote control button, this device will be producing a vibratory signal, pneumatic vibratory signal to the patient. This is a filter which is connected to the device, and the other end is connected to a mouthpiece. So this device delivers a vibratory signal which transports the secretion periphery of the lung to the central airways. The effect is transient modification of the rheology of the mucus, reducing its viscosity and improving its mobilization towards higher bronchial tree. At the end, after the procedure, the patient can expectorate. So this is a handle which is portable. As I told you, there are the control panel, and this is the remote control. So when the patient presses this, This device will be producing a pneumatic vibratory signal. So the filter is connected to the device. The other end is connected to the mouthpiece, and this is the remote control. Indications. This device is used in cystic fibrosis, bronchiectasis, and COPD. Now, what is the principle of Simeox? This generates a frequency similar to that of vibrating cilia of the bronchial epithelium during relaxed expiration by the patient. So this device produces a low frequency, that it produces a pneumatic vibratory signal when the patient is expiring. That is, it sends a low frequency vibratory pneumatic signal throughout the whole patient's bronchial tree, liquefying the mucus. So this device produces a low frequency pneumatic vibratory signal, and it is synchronized when the patient is expiring, and the patient can expect it at the end of session. So you can see over here, this device, the mouthpiece, is directly connected to the patient. So only when the patient expires, you're not able to see the remote control. He presses the remote control, and this device is going to give a positive pressure to the patient. So the intensity is set like 25%, 50, 75, and 100. Is up to the patient how he sets the intensity. So the patient begins by slowly inspiring through the nose, followed by an inspiratory pause. The patient inspires, that's an inspiratory pause. And when the patient is ready to expire, the patient places the mouthpiece in his mouth and presses the remote control button to start the Simeox vibratory signal. And the go button must be pressed throughout the expiratory phase. So as I repeat, so the patient inspires, and when he's going for expiration, he places the mouthpiece in his mouth. He presses the remote control, that is go button, and it produces that pneumatic vibratory signal is given, which synchronizes with the patient expiration. So what happens? Patient expires, and the device is also giving a positive pressure. It creates a back pressure in the lungs and helps in mobilizing the secretions. So program 1, it's having 4 into 6. As I told you, 6, it's having 24 expiration cycles. Program 2, 4 into 8, 32 expiratory cycles. Program 3, 4 into 10, 40 expiratory cycles. So 6 exhalations per cycle. So 6 into 4 is 24. Program 2, 8 exhalation. 8 into 4 is 32 expiration cycles. And program 3, 10 exhalations. 10 into 4, 40 expiratory cycles. So we have already discussed this. So inspire, the patient has to inspire, and when the patient expires, he presses the go button, and it creates a frequency of 6 to 12 hertz, minimum 6 to maximum till 12 hertz. So this succession of very short negative pressure pulses intensifies, diffusing a vibratory signal in the bronchial tree. This acts on the rheological properties of the mucus. That is, the viscosity of the mucus. That's rheology means viscosity of the mucus is reduced. This liquefied mucus is transported from the periphery pulmonary zone to the central airways. Video again now will be shown later. Now coming to the recent advances. Feasibility and safety evaluation of Simeox device in patients with bronchiectasis. So again, they wanted to check the feasibility and the safety of devices in bronchiectasis patient. The outcome measure used were forced expiratory volume in 1 second, and the sputum collection, and chest expansion, and SpO2. At the end of the study, it was concluded that there was significant improvement in both the groups, and Simeox device, that is conventional chest PT, was also better, as the manual chest PT, which was better. At the same time, the Simeox, the other group which was used by the Simeox device, it was also giving good results. The study concluded that both the groups and the Simeox device was considered safe and feasible for airway clearance management. So I'm done with the PowerPoint slides. Now I'll try to explain by showing the video of the devices. Ma'am, are you able to see the video?
Yes, yes.
Okay, fine. So there is no audio. I'll be trying to explain along with the video. So this is the Aerobica positive expiratory pressure device. There are 5 resistance settings in this device. So you can see the one which is going towards right is minimal and left is going to the maximal resistance. And this device is set as per the healthcare professional. First, initially, the patient has to inspire, hold for a few seconds, and then step 3, inhale deeply, hold, and then go for a complete exhalation. As I told you, there is no audio. I'll be explaining along with the video. So the patient has to concentrate more on exhalation to create a positive pressure. 10 to 20 exhalation as per the patient, and then followed by 2 to 3 huffs to clear the airways. As I mentioned, this device is also connected with the nebulizer. You can use the medications, induce the medication, and directly you can connect it with the Aerobica device. You can see here he is directly connecting to the Aerobica with the help of a nebulizer, and he can use this, and this also helps in clearing the airways. So this is the first video of Aerobica. Now the second video is of MetaNeb. So MetaNeb device. There are 3 therapies in one device. It is used for lung expansion, secretion clearance. Yes. So CPAP mode. This CPAP mode is used along with aerosol. It produces a positive pressure, which helps in pushing the secretions. At the same time, it pushes air beyond the retained secretion. And next one is called as CHFO, that is continuous high frequency oscillation mode. And this helps in pushing the secretions from the peripheral to the central airways. Continuous high frequency oscillation. And the third mode is called as the aerosol. So it pushes, at the same time it reduces the viscosity of the mucus. And third one is called as the aerosol mode. This is given directly to the patient. And this device is considered as an effective device to prevent atelectasis. And the time duration is around 10 minutes. So this comes end of the second device called as MetaNeb. So it's just one device. It has a stand, and over here, sorry, you can see the oxygen port which is connected, and it helps in preventing atelectasis. Now the third video is of MetaNeb. This video shows how it is connected with the ventilator. So this is a patient who is connected to an endotracheal tube. The therapist has to note the modes of ventilator before you connect it to the patient. It's connected to an oxygen supply. The ventilator modes and alarms are all noted. The head end of the bed is elevated around 30 degrees. This is always good for the patient. The blue ring is removed, and it is installed. It is replaced by a black occlusion ring. And there's a spring valve T adapter. This T adapter is connected to the inspiratory limb of the ventilator circuit. This is the T adapter. Medications are induced. It is CHFO mode is usually preferred during this treatment, continuous high frequency oscillation. The machine is switched on and the handset is connected now to the patient's T adapter. The total duration, as we have explained, is around 10 minutes. And we have to take note of the alarm system, all the pressure, volume, all readings. And suction can be done if necessary during the treatment. So now the T piece can be removed, and then it can be again connected to the T adapter. The handset is removed, and again it is closed and it is connected to the ventilator. So this device has an added advantage which can be connected to the ventilator, and this is a T adapter circuit. Now, fourth device is the lung flute device. So patient in sitting position, slightly head down. The patient has to go for a deep exhalation, inspiration followed by a deep exhalation. You can see the reed which oscillates. You can see that this is a reed. This oscillates, which creates a back pressure, and then produces low frequency waves inside the lung and helps in pushing the secretions from peripheral to the central airways. So you can see the animated video here. The sound wave goes down and mobilizes the secretions from peripheral to the central airways. So this is the mechanism of lung flute. Next one is RC-Cornet Plus. As I told, RC-Cornet Plus has two settings. This is setting 1, that's what indicated over here, and this is setting 2. Setting 1 helps in promoting collateral ventilation. Setting 2 helps in clearing the airways. Patient goes on inspiration, expiration. So during this, it enlarges the airway and helps in promoting collateral ventilation. It helps in lining the alveoli and helps in promoting collateral ventilation. This is the mechanism of setting 1. And this also, the nebulizer also can be attached with this device. Setting 2, it helps in mobilizing the secretions in the airway. So patient inspires and then patient expires, so it creates a back pressure, and you see the mucus over here. It reduces the viscosity of the mucus and it is pushed. So these are all pushed towards the central airway. So this is a benefit of setting 2. At the same time, he can, by moving the mouthpiece, there are 4 resistance setting 1, setting 2, resistance setting. There are 4 resistance setting. By moving the mouthpiece, he can adjust the resistance setting. That is what's shown in the video. Yeah. This comes end of RC-Cornet Plus video. And next one is this RC-Cornet trachea. Now this is a patient who is having a permanent tracheostomy tube, and how he uses this device on this patient. So the modified mouthpiece, which is present for this RC-Cornet Plus trachea. He adjusts the setting 1 initially to open the airway, and he can even. And so this device can also be used in tracheostomy patient, permanent tracheostomy patient. At the same time, a nebulizer also can be used on these patients. This comes end of the video of RC-Cornet plus trachea. And the last is the Simeox device. So one end, the filter is connected over here. The other end is the mouthpiece, which you see over here. The patient is either in a sitting position or he can even go for a side-lying position. The patient, you can see over here, the patient expires. When he expires, he presses this. This is a remote control. He presses this button, and then this device is going to give a pneumatic vibratory signal to the patient. So during expiration, he presses. Yeah, now he presses and it produces a pneumatic vibratory signal. Inspires and then expires. Yes. Now the therapist has to teach the patient. Initially, he has to educate the patient how it has to be done. So he teaches how to inspire, and then now how he expires. The therapist teaches him, and when the expiration, the patient has to press the remote control button. At the same time, he has to synchronize with the pneumatic vibratory signal. So the therapist encourages the patient inspiration, how to inspire and how to expire in synchronization with the Simeox, that is with the pneumatic vibratory signal. So this comes end of the Simeox video. Can you see the slide, ma'am? Can you see the PPT?
Yes, yes.
Ma'am?
Yes, sir. Yes, sir.
Okay. Now a summary of all the devices. First, the Aerobica, lung flute, Quake, and RC-Cornet plus. So now it's time to summarize the devices. So there are 5 resistance settings in Aerobica. Here the mylar reed is there in lung flute, and there's rotating handle there in Quake, and resistance. There are almost 4 resistance settings in RC-Cornet plus. These are the resistance settings present in the different device, 4 different devices. Now Aerobica and RC-Cornet plus, the nebulizer can be attached. In lung flute and Quake, nebulizer cannot be attached. Aerobica is lung flute and RC-Cornet plus is used during expiration, and Quake, as we have mentioned, it is used during both the phases of inspiration and expiration. So there's a difference between Aerobica, lung flute, Quake, and RC-Cornet plus. Now comparison between MetaNeb and Simeox device. MetaNeb, it is used for lung expansion, secretion clearance, plus one more is aerosol. 3 functions are there in MetaNeb. Here it produces only the pneumatic vibratory signal. MetaNeb can be connected with the ventilator. Simeox cannot be connected to ventilator. It requires the oxygen supply, so it should be connected to the oxygen supply, MetaNeb. This device is not connected with the oxygen supply. Aerosol delivery can be given in MetaNeb, and aerosol delivery cannot be given in Simeox. So this is the difference. So there are 4 differences in between MetaNeb and the Simeox device. These are the other 2 devices which you may be aware of. There is Acapella, Flutter. I think you might be unknown to these devices. That's why I'm not covering these 2 devices. So you can ask your questions now.
Yes, please. You can do screen share.
Yeah.
Stop.
Yeah, I'll stop it.
Participants, you can raise your questions. Those who are watching in the YouTube Fitness and Rehab India YouTube channel, you can write your doubts in the live chat. We will read your question in your Zoom meeting. Yes. Rupesh, are you there, Rupesh? Okay, let me read it out. There is a question from Pavisha Thakur. Tell us more about a cappella.
Okay. A cappella I have not discussed, but fine. A cappella is also an airway clearance device. It also has a resistance setting, a cappella, and it has a minimal resistance as well as maximal resistance. It can be rotated to minimal and maximal. And this a cappella device, it has an added advantage. It can be connected with the bronchodilator. And it has around frequency around 6 to 30 hertz, minimal 6 and a maximal of 30 hertz. It's similarly like other devices like Aerobica and RC-Cornet Plus. And this also can be used in all like COPD patients, bronchitis patients, and all other respiratory conditions who are in secretion. So a cappella, it is having a resistance valve that is minimal and maximal. It can be adjusted. Yeah. So prices you asked, if I'm right. The price, yeah. So first one, price, yeah.
Yes.
A cappella is around 3,000 rupees. It is available in Amazon, or you have a lot of distributors. 3,000. Aerobica are almost the same range, almost 5,000 rupees. MetaNeb is slightly expensive. It's around 3 lakhs. RC-Cornet Plus lung flute is around 4,000 rupees. Quake is around 5,000. And one more, the last Simeox is around 5 lakhs. So Aerobica, I think MetaNeb is a Singapore-based company in the US. Simeox is a France-based company. A cappella is available in India. Yes, it is available. RC-Cornet Plus, go to the website and check whether it's available. RC-Cornet is available. Plus, go and refer. I have done 4 studies in this. I have done on lung flute. It is available in India. Mumbai, the distributors are available in Mumbai. A cappella is available. Yes, it is available. If you want any doubts, you can contact me. Lung flute is available. Quake is a US-based company. Maybe Simeox and the MetaNeb is highly expensive, but it's available. It's expensive, but yeah, other 4 devices are available in India.
Okay. The next question is from Amulya Datta. Sir, along with the postural drainage technique, can this device be used?
Yes, it can be used. Definitely, it can be. Once you go for PD and you try to give along with these devices, educate the patient, it can be used.
Thank you. The next question also from Bhavisha Thakur. What would you advise? If I'm working in ICU setup, which one shall I definitely have?
Yeah, it depends. Like ICU setup, that is intubated patients, as per the PPT, you have to go for a MetaNeb. Now, once the patient is extubated and you want to go for the airway clearance, you can go for all the devices. Now, see which is cost effective. Now, I told you a cappella is of less cost. So, it's having the same function like Aerobica as well as RC-Cornet Plus, see which is cost effective, and you can go for the devices and see which is effective. All 3 have a resistance setting. So, when the patient is extubated, you can go for the RC-Cornet Plus, Aerobica, as well as a cappella, which I have not mentioned here. If the patient is intubated like endotracheal tube, you may have to go for the MetaNeb devices. And tracheostomy, as I've already discussed, you can go for RC-Cornet Plus tracheo. But the patient should be more conscious and oriented.
Okay, thank you. The next question is from Nirali Pandya. Is there any particular mode of ventilation in what we have to give MetaNeb?
Actually, yeah, mostly it has to be in the patient should be conscious and oriented. So in SIMB mode or CPAP mode or BiPAP mode, that will be better. Although we have not used this, I've come across when I was just going through recent advances. So if the patient is in synchronized intermittent mandatory ventilation, CPAP, that is, he should be more conscious, spontaneously breathing. So that time, I think this device can be used along with in ICU setup, mostly SIMB mode or CPAP. Definitely, it can be, to my knowledge, I think it can't be used in CMB mode, controlled mandatory ventilation of VC modes. volume control mode? The answer is patient should be spontaneously breathing, and he should be much oriented while doing these devices. That will be better. Yes,
Thank
sir.
you so much. The next question is from Dr. Hiral Jain. Good evening, sir. As we saw the goal of these devices in airway clearance, so how do we decide which one to choose if goal is bronchial secretion?
As I told you, sir, yeah, go for like all the three devices are available. So whichever you feel, which is like I'll go for Aerobica, and I can even go for Acapella because it has resistance settings. So it has as it has a resistance setting, you can increase and decrease, and frequency. Acapella, as per research, says that it has around 30 hertz. So you can go for Acapella, and or else even you can go for Aerobica. So try to use it on patients. See how you can even do a comparative study between Acapella and Aerobica and see which is effective as per the patient preference. You can even take one of the outcome measure which device is effective, because I have done on Acapella, I have done on lung, flute, and Quake. Quake is also done. Aerobica I have not done. This is just one of the recent advances which I want to explain. At the same time, I have not done on Simeox or MetaNeb. But these three devices, yes, can be used: Acapella, Aerobica, and RC-Cornet Plus. Yeah. And see for the cost. That is up to you. Cost and this thing, frequency. Yes.
Thank you.
Yes,
Thank you so much. And the next question is from S. Rajeshwari. Some patients' device used that time, vomiting sensation. That time, what advice you give?
Vomiting, mostly stop the session. Mostly you should not go for the session. As I told in contraindication, any vomiting or any dizziness, try not going for the device. Give some break. Maybe patient is not educated about the device. First of all, the most tough part I feel is educate the patient. That is very important. And after that, go for the therapy. Directly, if you go, definitely patient will be anxious in doing the device. Educate the patient and then go for the device. That is very important. Or else he may get that dizziness or vomiting. If there is vomiting, stop the session. It's contraindicated. Yes, sir.
Okay, thank you. And thank you, Dr. Neelima. It was a very enlightening session. Thank you, EXRX India. We have waited for this topic. Last series, we couldn't bring this topic due to some technical glitches. We couldn't do it.
Yes.
So we don't want to miss it. So we made it today. We should be thankful for our resource person. And from Nirali Pandya, can we add postural drainage position with these devices?
Yeah. See, actually, PD can be done, but most, whether it is sideline, try to go for upright sitting position. It's a physiologically better position, and then go for the airway clearance. I think upright sitting positions will be better for a position. Yeah, PD is accepted. It's good. You can go for a conventional. We can go for all the chest PT techniques, percussion, vibration. Yes, it's accepted. But try to go for a encourage the patient to go for a high sitting position. That's a better position for airway clearance technique. Yes, sir.
Okay, thank you. The next question is from Amulya Datta. Can the mouthpiece be changeable or is it was washable?
It is washable. Yes, there are. If you see the guidelines, if you see the brochure of all these devices, it is washable, and it should be only used for a single patient. That is something which you have to note down. It should be used for a single use patient. It cannot be used because of cross infection. Try avoiding using this device in because of the cost. We can't use because a device is costing 4,000. You can, if you are doing a study, it should be used in 15 patients. That is where actually get the funding and try to do it on. It should not be used. It should be used only for single patient use, not for multiple patient use. And it can be washable. There are guidelines given how to wash. You can see the brochure of all this. I'll be sending. You can give your email. I'll be sending all the brochure and the videos of all the devices. You can see it. Yes, sir.
Thank you. Madam Duna, madam, is there any questions in YouTube? Please check.
Sir, there are no questions, only a few appreciations are there.
Okay, there are appreciations in the YouTube for our resource person. And can we conclude? Any participants who wants to ask any questions, please, you can ask our resource person directly, or we will conclude.
Even you can unmute yourself and talk.
Yeah. One message. Two message.
Questions, sir?
Thank you, Nirali Pandya. Thank you, Professor Satyraja. Yes, you always ask some questions, but there were no, today there is no question from you. Nice. Please explain briefly.
One question is there.
Okay. Simeox device. Okay. Yeah. So this device, it's a device.
Sir, I think you need screen sharing.
Okay. Okay, I'll start from here.
Yes.
So maybe the parts. Okay, first I'll see there are 3 programs in this device. Program 1 is it is producing 6 exhalations per cycle. Program 2 8 exhalation. Program 3 10 exhalation. And this is about the power. As I told, 25% will be minimal, 6 exhalation minimal. 75%, 25, 50%, 75, and 100%. So this device is directly connected to the mouthpiece of the patient. So you can see over here, this filter is connected to the device, and the other end is connected to a mouthpiece. So you can see here, when the patient inspires and when the patient expires, the patient presses the remote control button. At the same time, this device produces a pneumatic vibrator. It produces some vibration. So when the patient expires, this device produces a vibration. So what happens? Patient expires, device is also giving a positive pressure. It creates a back pressure in the airways and helps in mobilizing the secretions. So that is the principle. So this device, the patient is actively participating. He presses the remote control button, that is the go button. It gives a pneumatic, that is, it creates a vibration. It is produced only when the patient expires. The patient expires, at the same time, the device gives the pneumatic vibratory signal, and it helps in mobilizing the secretion. So the device, I'll just repeat once again. This device can be given only when the patient expires. Patient expires, and then the vibratory signal is given. So it has to synchronize. That is very important of this device. Although I have not used, this is a France-based company. Although I have not used this, this is what I read from the literature. Yes.
Thank you, sir. Thank you so much.
Yes.
Duna madam, can we conclude it? I hope.
Yes, sir. I think we can conclude.
Yeah. Thank you so much, Dr. Vishnuvardhan, for your effort to teach us about Airway clearance devices used in cardiorespiratory physiotherapy. Though we have failed the last time, but you have made it. We have made it this time.
Yes.
We don't want this session to be missed. Actually,
yes,
there were many participants were disappointed. They were asking for your videos. Now they can watch your program. Even if they missed it live, they can watch it later in our YouTube. Thank you so much.
Thank you, Dr. Chandram, for giving me an opportunity. It was really grateful, and I would like to thank the organizing team, all the technical team, as well as my dear students who are always with me, who always encourage me. Because of them, I am here. Thank you, sir. Yes. Thanks a lot.
Thank you. Thank you so much. We hope we will be having another one more topic from you.
Yeah, next week most probably.
Yes. Thank you, sir. Team, Dr. Professor and Dr. Rupesh and Professor Duna, and thank you all the participants and who stayed till the end. Actually, nobody left. It was a nice session. Though we have some 55 till the end, they were there, and there were few in YouTube also. Thank you for all the participants for supporting.
Thank you all.
Bye bye. Good night.
Yeah. Thank you, sir.
Thank you, sir.